We'll start with the flight announcements. How many of you have flown in sometime over the last few days to get here? Oh, not everybody. So now, as I said, after I say a few words about the outcomes, give everybody a chance to say hello and where you're from. I want to go over the agenda with you so you'll have the plan until... This is a story roundtable. We got motivated because we wanted to be able to collect more than we knew about what was going out there in the world. And the first people I sat down with when I asked, well, why are you here? They said, well, it's lonely out there. You know, it's easy to feel that you're off there by yourself. And so the fundamental part of this was to get the stories out, to have this exchange, with one of the consequences being you'll get that you're not alone, and much more of a sense of solidarity leaving here. So that said, we all have many occasions that we may or may not fully appreciate to tell our stories. We're hoping that we provide a valuable one for you, as well as to have some opportunity to continue to sharpen your story and refine it, particularly with the subject of financing for funders, so that we've got persuasive cases for investors. So how to do that, as well as how to be effective in what we're doing, a purpose is that there's an exchange, and that's why we've asked you, particularly tomorrow, to focus on some questions about that and how they apply to your story, to be able to focus some of the exchange. But of course, we also imagine that there's a lot more that can happen than will happen in the time that we've got allocated. However, from what we share, a purpose is to get some insight. And I'm actually going to ask you later to think about something very specific you're working on that you hope that you leave with insights about how to continue to approach that. More substantive introduction time to say a little bit about why the roundtable, and also something about ReThink Health and how we got here. So, Laura, you should. Yeah.
Right, so I have 15 minutes to tell the 60-year history of So, as Sharon was saying, my job is to kind of set the stage a little bit, give you guys a little bit of history and context, talk about why we're doing this roundtable, a little bit about why you guys are in the room, and then I will pass it over to Ruth, who will then pass to Bobby, and we have a fun day, and then followed by a fun dinner. So I'm going to start with something that we all know. I mean, we wouldn't be in this room if we didn't know that as a country we're spending more money for shorter lives, and that not only do every one of you want to be the best place for health in the country, I think we're also struggling to be the best place for health in the world. So, you know, we've got competition here, but we've also got competition there. So we've got an even bigger problem than we think we do. So why a roundtable? So being the healthiest place, whether it's in the country or in the world, it's really, really hard. It is not an easy thing to do. We've been working at this for a long time. We keep running into problems. If we look at the survey results that you folks filled out, and the data we have that aggregates your comments, the comments are talking about the problems in transitioning in leadership, the problem of sustainable financing, the problems of setting clear goals, the problems of keeping this thing going after the initial couple of years. All these are things we're going to talk about over the next couple of days, things ReThink Health has been working on, but it's really, really hard. And I think we need to own that. So in coming at trying to deal with how do we get to be the healthiest place and acknowledging that it's hard, ReThink Health has really carved out a role for itself, which we're going to talk about a little bit and where it comes from. But to really, one of our key strategies is to create meetings like this and places where we can really bring people together, not knowing what the outcome is going to be, not trying to control, you know, what is going to be said, not having talking heads up here so we know every single minute and what's going to be done. You know, we can't write the report of this meeting, and we don't want to write the report of this meeting before it happens. We want to write it after it happens. So there's very much an experience that I think you've already started to feel about how ReThink Health actually tries to learn and tries to advance the field. Let me talk a little bit about where that comes from. So the ReThink Health is part of the Rippel Foundation. Rippel Foundation is a charitable foundation. It's based in New Jersey. We've been around for 60 years. We historically were very traditional. We gave grants for basic cancer research, and we built hospital wings, and we bought microscopes, and have our names all over the place. But about 7 or 8 years ago, when I became president after being on the board for a number of years, we started to dig into the history. We started to say, hey, maybe the assets of the foundation could be used differently from how we're now using them. And found in our history the writings of the first president of the foundation, a guy named Julius Rippel, Dartmouth grad, investment guy, there because he was part of the family. And what we started to see, and I know this is a lot of words on a small slide, but going back to the 50s and 60s, we started to see language that we were hearing Don Berwick making speeches about in 2010. That, you know, we've got to make hospitals for the patients, and we've got to figure out how to get people healthy, and we've got to redesign what we're doing, and we've got to change habits. So we really have to develop a health system in addition to a healthcare system, and these two have to go together. So what was really particularly interesting is that even back in 1959, Julius A. Rippel was saying, for a long time we have known that, right? This was not new information in 1959. It was old information in 1959. So we've been talking about this stuff for at least 45 or 50 years, but we haven't made the change yet. But what we don't know, even with all of this, is how do you build and sustain system-wide change? How do we actually take those examples, those problems, that evidence, those measures, and actually make it turn into something that's going to have lasting impact on our lives, the lives of our kids, the lives of our grandkids, in a way that we wanted to do?
Themes from what Laura was just talking about that I want to pick up is the question of who is in the room and what is this group all about. And the second theme I want to pick up is Laura was talking about the nature of the work that we do at ReThink Health, which is learning from leaders like you what are the kinds of sticking points and challenges that you are facing in your work in trying to create healthy health systems in your own regions and communities, and what kinds of tools and frameworks would be helpful to you in progressing your work. So I'm going to set the stage a little bit by talking about those two things, and then I'm going to give you a little work to do in preparation of telling your stories, but then the bulk of the time is going to be spent hearing from each of the groups that is represented here about the purposes and accomplishments and challenges and origins of your story. So stewardship toward a healthy health system. You know, Laura said earlier that there are a number of sort of original rethinkers that we take a lot of inspiration from, who come from sectors outside of healthcare. And one of those very important influences is the work of Elinor Ostrom, the Nobel Prize-winning economist, who found that not every community, when faced with the potential to overuse a public resource, actually falls prey to the tragedy of the commons. And we view this as a gathering of stewards. That's what this group is about. Intentionally or unintentionally, the work that you have been doing in leading your regional health systems has been about stewardship. And one of the ways that we think about the job of stewardship can be the question of what are the kinds of conditions that you are creating in your local systems to make room for other leadership to get involved, to increase the chances that progress will be sustained and that this developmental journey will continue to progress over time, closer and closer to the ideal system that you and your residents want. And
had a long day. Many of you began very early today. But we wanted to sort of take at least one more step that'll position us for a richer discussion tomorrow. And what you just went through with the developmental assessment and locating yourselves on the pathway was a pretty structured process of seeing connections around stewardship, strategy, and financing. And what we wanted to do now is sort of get into a deeper set of the hidden choices, the additional choices, the artistry of how you maneuver along this pathway, and to see this work for where it might lead next. And because of the strategic choices ahead, and most importantly, how those choices get linked to the resources that actually make them real. So that's really what we're aiming for here. It's going to be grounded in a couple common predicaments that will illustrate briefly, but then more importantly are the predicaments that you're experiencing and the pathways that you imagine going ahead. I'll do this, my part, with a couple illustrations of results from simulation scenarios. Many of you, I think almost everybody in this room spent some time this afternoon looking at the model, right? Is there anybody that totally missed that? Okay, good. So you have a working sense of the tool. And what I'm going to do now is sort of summarize some of the major insights that we've seen over the last couple of years of using this with many organizations. Not coming up with a perfect scenario, but showing how the links between strategic choices and financing end up becoming pretty significant. And then we'll have a very brief table exercise where you can sort of consolidate your thinking on this. We'll harvest those lessons, and we'll end with some observations from our connectors who are here today, and then we'll go on and make sure that we're all oriented for what's going to happen tomorrow, which is really the heart of this.
In Pueblo, the things we're trying to address are, we're 56th out of 59 counties in Colorado in terms of our county health rankings. In the healthiest state in the nation, we have health statistics that look like the Deep South. So we're even dragging the state down even further than it already is. We spend $1 billion on health care. 30% of our diagnoses in our hospitals have a diabetes relation to it. Our teen pregnancy average is 50% above the state average. There's a lot of issues we need to look at. So we're specifically looking at teen pregnancy. We're looking at obesity. We're also looking at smoking, because our adult smoking rate is 7% higher than the state average. And in the healthiest state in Colorado, that doesn't look real well when you're trying to recruit companies to come to the state, if you want to recruit families to come live in your community, if you're trying to impact the overall well-being of your community. And we have 160,000 people we're trying to impact. You've got to start working on those issues, and they must be looked at in tandem rather than individually and siloed. How do you impact one positively that will impact 10 positively, rather than looking at one and hoping that maybe that one will have the gigantic impact among many.
So I thought before we do the very final closing, to just quickly check in with whoever would like to share something about what they're taking away and some actions that they plan to take. My hope is that we will be in touch so that there could be some progress reports from this. So whatever you'd like to share. So who would like to start? Yeah, great.
Should I come up?
No, you can.
Okay,
You
good.
want. I think it's probably
Okay. So on the real tangible level, the different perspective on sustainability and engagement of funders was amazing. That was great. And I don't even mind the bottleneck, because there was so much information that came out that I'm very happy to see that. Finding alternative pathways to do the work that we are already doing. Very often we get on one path and we don't look for any other way to go. And it was really mind-boggling. The excitement, Bobby, of what you are doing is like unbelievable to us. And our action for right now is, how do we get you to Fall River? That's what we want to know. We learned that we're not alone, but we also learned that we're very unique, so maybe we are alone. So that sort of balance is very interesting to us. We already had begun creating a stakeholder list and a leadership group list. I don't know if you've noticed, Dave writes on his little index cards. We already have a whole card full. And the alternative fundraising, we've already begun talking about that. And how to sharpen our story to talk to potential donors to cultivate interest above and beyond just, we'll sign an MOU kind of thing. So some of our concerns are, how do you modify these ideas to fit our tiny budget? Lloyd, was that the name of the gentleman? Okay, so when Lloyd stood up and he said, well, I don't expect you to get $25 million, but at least $1 million. We've never seen $1 million ever. So to us, that was, some of you are functioning with so many resources and so much money, and we're this tiny little place, but we sort of felt we held our own. And some of the things we'd like to see how we can continue to connect is Dropbox or video diaries. We love the face-to-face. We will walk out of here feeling and holding this high, and going back to our friends and telling them all about it, and that will keep us going for a while. We'd love to see regional meetings where maybe ReThink Health would help us convene some kind of meeting for our connecting community to make that happen. And we'd like to be able to tell our story out of the box in out-of-the-box ways. Unlikely partners, find those. And we also think that in the future, we'd love everybody to bring an intern. Because we think that if I brought a 20-year-old with me, it would change his or her life.